Bone scanning. What is bone scanning?
Bone scanning is a nuclear medicine procedure which basically looks at the turnover or reaction in the bones from a variety of reasons. We can use bone scanning to diagnose metastatic dissemination of cancer in the bone, or use it for looking at infection of the bone, fractures. Any disease process that involves the bone, bone scan is useful for.
How can I prepare for bone scanning?
There is really no major preparation for bone scanning for the patient. We only ask the patient to be well hydrated before, during, and after the procedure to decrease the radiation dose to the urinary bladder where the excreted tracer is accumulating.
What does the equipment used in bone scanning look like?
The equipment that is used for bone scanning is basically same as the equipment that we use in other general nuclear medicine areas and in nuclear cardiology. They are either planar or SPECT systems which have gamma camera heads which collect the gamma rays from inside the patient and form an image through a computer.
How does bone scanning work?
Bone scan works through the activity of the radio tracer technetium-99m-MDP, which basically collects at the areas of bone formation, either around tumors, infection sites, or fracture sites. Basically, for example, in area of metastases or tumor, that metastasis is being contained by the normal bone around it. And that bone formational reaction is an area where the MDP goes and attaches itself to. Therefore, it's an indirect way of looking at the tumor. In patients who have fractures, again, there's healing going on in that area of the fracture by new bone formation, and technetium-99m-MDP goes into those areas. And that's why we are able to image areas of fracture even earlier than what we can see with the regular X-ray. You can see the reaction much earlier. And with the infection, there's a similar situation. The areas of infection, the bone around the areas of infection are reacting by forming new bone, and those areas are where the MDP is attracted to, and we are able to image areas of infection.
What will I experience during bone scanning?
There is really no specific sensations that occurs during a bone scanning. Again, a small amount of pain at the time of tracer administration intravenously, and very rare possibilities of side effects or allergic reactions that we already talked about. But other than that, there is really no specific sensations that the patient may receive during a bone scanning procedure.
What are the benefits of bone scanning?
Similar to the other procedures in general nuclear medicine and in PET, benefits of bone scanning is tremendous because it tells us, depending upon what the disease process that we're looking at, a good amount of diagnostic information which is important in the care for the patient. For example, in tumor scanning, we are able to find out what the extent of the disease is to the bone from a primary tumor, and that can impact treatment in that patient. If a patient is suffering from infection in the bone, we are able to image that and treat the patient appropriately if the infection is in fact seen. In patients who have fractures, that also can be important for the appropriate treatment. For example, if a patient who has fracture in parts of their spine, it's also been used or is used in child abuse cases where there are different types of fractures of varying age in children, and it can be an important part of the puzzle to see if in fact there has been a child abuse case.
What are the risks of bone scanning?
The risks of bone scanning is basically related to the radioactivity that is administered, which is extremely small and very similar to the other tracers that are used in general nuclear medicine. With frequent voiding and good hydration, the radiation dose to the urinary bladder, which is the major organ which receives the most of the absorbed dose in this case, is diminished tremendously.